Good afternoon. I'm Dr. Stephen Castor. I'm the Chief Medical Officer at Menorah Medical Center, and welcome to today's edition of House Calls. It's our seminar series that we have where we feature our outstanding physicians that we have at Menorah Medical Center and talk to you about different topics that are of interest to our community. Today we have our guest is Dr. Nicole Fearing. She's one of our bariatric surgeons, and today we're going to be discussing COVID-19 and how it affects those who also have obesity. Dr. Fearing is, in addition to her clinical role, is also currently president of our medical staff, and we're grateful for her service that she's had to our facility. So, Dr. Fearing, welcome.
All right, thanks for having me, Steve.
So, tell us about the latest studies about what COVID does in patients who are obese.
So there's several studies that have come out now, and they're from all over the world, whether it's the United States, the UK, France, Italy. And a lot of the studies are now showing that people who have obesity, a BMI greater than 35 or BMI greater than 40, have more serious repercussions when they do get COVID. So some studies out of New York are now showing that people with obesity will be more likely to be hospitalized, and when they are hospitalized, it's more likely to have serious issues, whether it's being on the ventilator longer or going into the ICU.
Can you explain what BMI stands for and how it's calculated?
So BMI stands for body mass index, and it's a calculation that is an estimate of your body fat content by using your height and your weight. It's an inexact science, but it's what the National Institute of Health gives us to use to quantify body mass index.
So we know that when COVID first came on, there was a big concern that patients in their 60s, 70s, and 80s had a more significant adverse outcome from COVID. Are you finding that younger patients with obesity have a more severe outcome?
So we're seeing right now what the studies are showing, second to age, the #1 risk factor for serious complications with COVID is obesity. And so what we're seeing with our younger patients is that the younger people who are having serious complications with COVID-19 actually have BMIs greater than 30. And as the BMI goes up, those risks go up as well.
Okay. Oh, and for our viewers, if you have any questions that you would like Dr. Fearing to answer, please send those through the Facebook app, and we'll be happy to answer those. So next question, inflammation. We hear a lot about that and how that affects the body. Can you describe how inflammation that's associated with obesity affects the body, and specifically how it affects those with COVID?
So we know with COVID-19 that there's an inflammatory response that happens in the body. We know when we're overweight and we have more fat in our bodies, we have more inflammation. There are more cytokine responses that occur. And so with obesity and having increased body fat content, we know that there's more of a pro-inflammatory response, and that if you're adding one inflammatory response to someone who's already having an inflammatory response to this virus, it can be very significant. The other thing that we're seeing as well is when people develop COVID-19, we're seeing more thrombosis, meaning more blood clots in patients. And so we think that's what we call an endothelial problem, a problem with the lining of the blood vessels. And we know with obesity that people have an increased risk of blood clots. And so we know that those two things go together as well. So we've got increased risk of blood clots and more inflammation in the body.
Okay. So can you explain how, when you're approaching someone with obesity, how do you go about doing your evaluation in your office and deciding whether somebody needs surgery?
So when we look for people that have obesity and higher BMIs, we talk about what does the NIH use as criteria. And so the criteria is a BMI greater than 35 with associated health problems such as coronary artery disease, diabetes, high blood pressure, or sleep apnea, or a BMI greater than 40. We also know, though, that like with COVID-19, that it actually, a lot of the studies are saying down to a BMI of 30 puts a person at risk. So when we're talking about lower BMIs that might not be covered by insurance, we talk about doing medical weight loss with patients or some of the endosurgery options or endoscopic options for weight loss, whether it's a gastric balloon or the sleeve gastroplasty.
What do you advise your patients when they're just starting out on the weight loss process as far as diet and exercise? What kind of advice do you typically give your patients?
So I tell my patients to start small. And so, set small goals that they have that are obtainable. There's lots of different diets that work out there, but you have to find the one that you can stick with and do, and then just get moving. Little bits of movement mean a lot, whether it's parking farther away, whether it's not sitting all day at work and getting up and moving every hour. Those kinds of things are really helpful.
Great. Can you explain some of the surgical procedures that you do for weight loss and how you make those decisions?
So there are a lot of different surgical options for weight loss. Currently, the most popular surgery that is out there for weight loss in the United States is gastric sleeve surgery. This is done laparoscopically, and 64% of people who have weight loss surgery in the United States have gastric sleeve surgery. The second most popular surgery is gastric bypass surgery, and this has been around longer than any other weight loss surgery in the country. It's been around since the 1960s in various forms. Another surgery that's getting to be more popular is called the duodenal switch, and that is a surgery that we use, especially if people have really high BMIs, to get more weight off.
Okay, great. So we have some questions from our audience. The first one, if I have this weight loss surgery, what type of pain should I expect after surgery?
So everybody has some pain after surgery. Here at Menorah, we use what's called enhanced recovery protocols. So we do what we call multimodal therapy to decrease pain. So we give medications before surgery, we run special medicines after surgery, and then during surgery as well. So we're part of a national research program to try to decrease actually pain and pain medication needs after surgery. So you're going to have some, but I have some patients who really have very little pain after surgery.
Right. Next question. I've had weight loss surgery in the past and regained the weight. I didn't follow the diet I was given. Do you have support groups to help?
Well, good for you. Good for you that you lost some weight and got started on it. And just as an aside, one of the small studies that came out of Europe that show that people who had had weight loss surgery in their past and had lost some weight actually did better with COVID-19 than the same cohort. So if you've had some weight regain, that's okay. It's just you give yourself that grace and then you work towards getting back on. We do medical weight loss with people. We do evaluations of surgery to see, is there a physiologic reason that you're regaining that weight? And so we do have support groups here at Menorah Medical Center. We have a support group that meets the last Thursday of every month. We currently have it as a Facebook Live support group. So if you're interested in that, the Facebook group is called Non-Scale Victories, OPKS. And we have lots of videos that we put on there too if anyone is interested in viewing those videos.
Great. Next question. I'm in my late teens and very overweight. Am I old enough to have bariatric surgery?
Sure. So you can have bariatric surgery as a teenager. We currently don't have an adolescent program here. We wait till people are over age 18. But Children's Mercy does have an adolescent program that they do weight loss surgery there, and they have a Fit Kids program in their adolescent program there that goes up to age 18. And then we'll see people after age 18.
What is the best type of surgery for a woman in her late 30s and about 100 pounds overweight?
So it depends on all your other health problems. And it depends on what your risk profile is. And so a lot of times we come in the office, we talk about all the surgeries that we do and talk about really what fits your goals and expectations for weight loss. Like I said before, gastric sleeve currently is the most popular procedure for weight loss, but a lot of people go with the other procedure at 100 pounds overweight with the gastric bypass as well too.
Okay. I'm in my late 60s and worried about COVID-19 and weigh about 350 pounds. Am I too old to have surgery?
You are not too old to have surgery. And so the best thing you can do right now is work on weight loss and just with small steps. Even a weight loss of 5 pounds can be helpful. The other thing is to do what's been recommended all over the place, is to wear your mask when you go out. Don't go out if you don't have to. Social distance and wash your hands like crazy. these things work. They're simple, you can control them, but also you can also be evaluated for weight loss surgery as well.
All right. And Dr. Fearing, you brought a visual with you today. I was wondering if you could kind of explain what that is for the audience.
So this is an example of what 5 pounds of fat looks like. And so fat doesn't weigh as much as muscle, but 5 pounds of fat is a lot. And this kind of shows the volume that it takes up. So when you think about, 5 pounds, it's not that much, it's a lot. And so any little bit of weight that a person can get off is going to be helpful. And so don't sell yourself short. If you can get 5 pounds off and then you can work for 10 pounds, that really makes a big difference in your inflammatory process in your body and your health problems overall.
Great. Well, thank you, Dr. Fearing, for joining us today. We appreciate your insights as we discuss obesity and the COVID-19 disease. So for more information about the bariatric program at Menorah Medical Center, please check our website, menoramedicalcenter.com/weight loss. Thank you all for joining us.